This is bad. So, former insurance agent battling cancer has a dying wish. Like, my dying wish on my deathbed, warn people. Like it's so awful. To not have a Medicare Advantage plan. Now, it goes on to say more than 1.8 million Medicare Advantage members are enrolled in 2024 plans that will not be offered in 2025. Another scare tactic. I am here to tell you that if your plan is not offered in 2025, you have guaranteed issue into any other plan that you want. So they're not just ending your coverage and you're not going to be without insurance, right? Now, if you don't select a new plan, you will be automatically re-enrolled back into Medicare Part A and B without coverage. But these insurance companies send out multiple letters. You have multiple opportunities to choose a new plan. They don't just like suddenly drop you and leave you, for dead, basically, So, and even then, you still have other options and other ways to go about getting coverage. So the scare tactics are abundant here. And this is also illegal because this is what's called steering. You're going to see a lot of steering in this article, and you are not allowed to steer anybody towards a plan. You can give them the pros and the cons. You can say, here's how Medicare Advantage works. Here's how Medicare Supplement works. Which do you prefer, or which sounds better to you? And then whichever one they pick, that's the one you sign them up for. It's just that simple. You give them unbiased pros and cons of both, and then go from there. So let's get into.
So is it possible that CMS doesn't have an objection because it's not directly soliciting from the public? Could that be it?
I mean,
because this is a news article as opposed to a direct mailing piece or sales literature in the appointment.
And that kind of stuff is, whatever, But anyway, so let's get into this thing. The Medicare open enrollment period began Tuesday, the 15th, and big changes are in store for Medicare Advantage patients in 2025. There's always changes in store every year. Nothing.
No surprises here. Yeah.
So it is a good time to review your plans and coverage now to avoid being caught by a surprise next year. No kidding. You think so? You think you should? Okay. Medicaid changes coming next year will impact thousands of seniors with higher out-of-pocket costs, higher prescription drug deductibles, and fewer supplemental benefits.